morning, everybody. Pleasingly, the New South Wales average for first doses is now over 74%, and we just encourage everybody to keep pushing for that. And in particular, in some of our hotspot local government areas, the first dose average is just amazing. Blacktown is over 85% first dose, Camden's over 86%, Campbelltown's over 82%, Parramatta's over 81%, Canterbury Bankstown's over 76% and Dubbo's over 77%. So we're really pleased with those results, and we just ask people to keep coming forward. And of course our message is don't be left behind. Obviously when these local government areas are in the high 80s and the state average is 74%, it means some areas in the state are falling behind, and we want to make sure we have targeted strategies in those communities. So don't be left behind when we start opening up, because when we open up at 70% double dose, it will be only for those who are vaccinated. So there's time now to get your first dose and then fit in your second dose before New South Wales starts opening up. And I just want to make that message as strong as possible. To 8 p.m. last night, we had 1,220 cases of community transmission, and regrettably 8 people lost their lives with COVID, and we extend our deepest condolences to them and their families. But we also appreciate that the best way to deal with the current outbreak is those high rates of vaccination, and I'm very pleased today to have with us Auntie Pauline de Weerd, who is the Executive Director of Aboriginal Health from St Vincent's, and she'll be speaking to us about the importance of our Indigenous community members as well as the wider community coming forward and getting tested. And she's one of the special people that takes care of people who have COVID, and will be sharing her experiences today and really encouraging people to come forward and get vaccinated. So Dr Chant now will give her update, the Deputy Premier will talk about the regions, and then Auntie Pauline will talk to us about the work that she does and encourage those high rates of vaccination. Thank you.
There were 1,220 locally acquired cases of COVID reported in New South Wales in the 24 hours to 8 p.m. last night, and there were 2 overseas cases reported to 8 p.m. last night. 100,745 tests. Again, thank you to everyone coming forward for testing. There are currently 192 cases in ICU, 75 of whom require ventilation. They are across all age groups, so I again reiterate the fact that no one should be complacent about COVID. Please get vaccinated. Tragically, there were the death of 8 people who had COVID, and I pass on my sincere condolences to their loved ones. The death of a woman in her 70s from Western New South Wales at Dubbo Hospital was announced yesterday. She was not vaccinated. She had underlying health conditions. There was a gentleman in his 90s from southeastern Sydney died at St George Hospital, and he was not vaccinated and also had underlying health conditions. A man in his 50s from Nepean Blue Mountains died at Nepean Hospital, and he was also not vaccinated. A gentleman in his 90s from southwestern Sydney died at Campbelltown Hospital, and he was a resident of the Advantage Aged Care Facility at Preston's Lodge, and he had acquired his infection there. He was fully vaccinated. He had significant underlying conditions. And there was a woman in her 70s from southwestern Sydney died at Nepean Hospital, and she was not vaccinated. Again, she had significant underlying health conditions. A man in his 70s from southwestern Sydney died at Liverpool Hospital, and he was also not vaccinated. He had significant underlying health conditions. A man in his 80s from Western Sydney died at Westmead Hospital, and he was not vaccinated. He also had underlying health conditions. And a man in his 60s from Nepean Blue Mountains died at home, and he had 1 dose of the COVID vaccine. He had underlying health conditions, and the coroner is going to look into the circumstances around that death, and certainly additional advice will be provided in due course. I would like to call out the suburbs of concern. They are Guildford, Auburn, Merrylands, Greenacre, Bankstown, Liverpool, Yagoona, Punchbowl, Dubbo, Bass Hill and Granville. But I'd also like to call out the Central Coast. We are seeing a number of cases increase in the Central Coast, so please come out and get tested. So tragically, whilst the Premier has announced that good achievement of the first dose coverage of quite a high level, when I look at the data, I still see many people over 70 unprotected. I still see many people in their over 50s that are unprotected. Please come forward and get your first and second dose as soon as possible. It is critical that you get vaccinated. You are most at risk of having hospitalisation and death associated with COVID. So please, can I just ask everyone to reach out to their loved ones, check that they've got a vaccine appointment and get vaccinated as soon as possible.
Good morning. I offer my condolences to those families that lost loved ones overnight, and you remain in our thoughts and prayers. Till 8 p.m. last night, Western New South Wales saw 27 cases. 18 of those cases were in Dubbo, 3 in Burke, 1 in Orange, 3 in Narromine, 1 in Walgett and 1 in Brewarrina. In the far west, there were 4 cases. 2 of them in Wilcannia and 2 in Broken Hill. In the Illawarra, we've seen 14 cases to 8 p.m. last night. 11 cases were in the Wollongong LGA and 3 were in the Shoalhaven local government area. Southern New South Wales, these were the 2 cases that we mentioned yesterday, 1 in Batemans Bay and 1 in Cooma. The Central Coast has seen a spike of 22 cases, and we are calling out to that community to be vigilant, to get tested, and to make sure that we continue to see vaccination rates go up. They're just slightly below the state average when it comes to vaccination, so a big call out to the Central Coast community. In the Hunter, there were 7 new cases, 2 in the Port Stephens local government area, 2 in the Lake Macquarie local government area, and 1 in Maitland local government area, the Mid Coast local government area, and 1 in the Newcastle local government area. Also in the Southern Highlands, 2 cases in the Widgecarriby Shire. That was 1 in Mittagong and 1 in Exeter. So again, a call out to everybody in the regions to remain vigilant. Big call out to the community of the Murray River. They've got up to their vaccination first dose 86.1% and 56.6% double dose in the Murray River. And the best improver for the week, Lachlan, the community of Lachlan, they've moved from 33% first dose to 64% in just over a week. So again, big call out to Regional Rural New South Wales, get vaccinated.
Hello, my name is Pauline DeWitt and I'm the Executive Director of Aboriginal Health for St Vincent's Hospital, Sydney. I'm standing here today as a proud Yuin and Gadigal girl with a message to Aboriginal communities across New South Wales. Please get vaccinated. Over the last few weeks, I've been talking to mob in remote and regional communities across the state and also here in Sydney and the South Coast. Many are willing to get vaccinated or already vaccinated, and some are yet still scared of the unknown and have not made up their mind to get the vaccination as yet. Family and connections are a huge part of our culture. Being with our mothers, our fathers, our grandparents, our sisters and our brothers and extended families is important to us and our identity and belonging. I know what is being asked of us to do is sometimes hard. I also know that we want to come together and have the freedoms of what we have always enjoyed in coming together with mob. But right now, our mob need to survive this pandemic. Staying home and getting vaccinated is the way that we will get through this. It is how we will make sure that no one is missing when we have the opportunities to get together again. All Aboriginal people aged from 12 years and over can access COVID-19 vaccine. You can talk to your GPs, the Aboriginal Medical Services, the Aboriginal health workers, or any vaccination centres across New South Wales about what is best to help protect you and all of us. I've heard that some people are worried about the vaccine. Vaccines have always been part of our lives. We vaccinate our children as babies before we send them to school to keep them safe from the diseases. We vaccinate them to prevent us from polio, rubella, measles and other diseases. Now we need to keep our mob safe from another disease. The COVID-19 vaccines are safe. If you're unsure about vaccinations, ask your health workers as many questions as you need to before rolling up your sleeve and receiving the jab. Vaccinations are a choice, and getting one may save your life and keep the mob safe. The health services in your area are there to help you. Your hospitals, your doctors, your nurses, COVID and testing clinics, vaccination clinics, these services are free and you will be welcomed into them to make sure you are well, to get tested or to get a vaccination. Through my work at St Vincent's, I see what happens to people who get really sick with COVID, who come into our hospital. I see the loneliness, I see the isolation. You are sick and you can't have your loved ones around you. I don't want that, and I'm sure you don't want that either. There's one particular Aboriginal patient we've looked after whose case really stuck out for me. He was really unwell with COVID and being in ICU on a ventilator for many weeks with no family around him. He's on the med now and doing okay now, but he's scared and hopes he never gets this virus again and is now asking for a vaccine to prevent this ever happening to him again. That's why right now, for all Aboriginal people across New South Wales, we need to listen to the Premier and the health professionals. We need to protect each other, especially mob, from this virus. I know it's hard, it can be scary, but we will get through this, and we will get through this soon. If you are anxious and not feeling your best, reach out to someone. This may be a professional, or just pick up the phone to your mob and have a good yarn about it. Please, stay at home, get tested if you have any symptoms, but most importantly, please, my mob, get vaccinated. Thank you.
We've had 60. Premier, we've had about 60 deaths in 10 days now. Are you expecting more or less deaths, a higher or lower death rate when you open up at 70 and 80% double vax?
Well, obviously, the biggest protection against being in hospital and against dying is getting vaccinated. And the more protection our community has, the higher rates of vaccination we have, obviously the lower number of deaths. And obviously last year, without the vaccine, when Victoria had their outbreak, they lost hundreds and hundreds of people. And we haven't seen that yet in New South Wales because of the vaccine. So the vaccine is our greatest protection. And I just urge everybody to come forward and get vaccinated. And in particular, I want to thank Auntie Pauline for her comments today and encourage all members of our community to come forward and get vaccinated.
But just on that, you said to me a few weeks ago that 80% double dose is 63% of the total population. Do you have any sort of modelling on the potential number of deaths a week in New South Wales at 80%?
Certainly none that I've seen, but I say this, the biggest protection for us is for people to follow the health orders and to get vaccinated.
Regarding the roadmap that's apparently imminent, October 14 is being reported as a potential date. Is that what you're working to for the 70% mark, October 14?
Oh, look, I'm very keen to make sure as soon as we've done the work and as soon as health has had the appropriate input that we make our roadmap public. We're looking forward to hitting that 70% double dose in October, and that's why I can't stress enough how much we're encouraging people not to get left behind. Because when we start opening up, it won't be those things that we've all missed will only be available to those who are vaccinated, and I just encourage everybody to do that. I don't want to put a date on it at the moment. We're still working on the detail, but it would be important to note that we've done a lot of work towards that already.
In regards to opening up, there's been some talk that areas of high vaccination rates with low case numbers will be the areas where restrictions are trialled, including the vaccine certificate and stuff. That would indicate places like Mosman or the Northern Beaches, but not places in the western suburbs. Noting that some of these hotspot LGAs have the highest rates of vaccination but still have high case numbers, would you be comfortable with people being able to have a rosé in Mosman, like Crispin suggested, but still face significant restrictions in Western Sydney?
Well, those where we decide to have any pilots would be up to the health advice. But what we'd be encouraged to do is to make sure that our Service New South Wales app, which allows people to check in and also indicate that they've been fully vaccinated, has to be trialled. And so we'll get advice from health as to where the best locations are for that. And I envisage it'll be a variety of locations to make sure that we get it right by the time we open up.
What about the idea that people will be able to go to the pub on the Northern Beaches because they haven't had any cases, but Western Sydney, which have some of the highest rates of first dose vaccinations in the state, will still face significant restrictions?
Well, there are a number of factors, and as we've said, our indication is that everybody who has 70% double vaccination enjoys the benefits of being fully vaccinated, and we'll make that obviously clearer once we make the roadmap public, but we also obviously need to take the health advice as well. But our intention is that everybody who has 70% double vaccination moves forward and has much more freedom than what we do today.
When does vaccine cover expire? Will there be a system where vaccine cover expires if you don't have your booster? Has that been worked out? How long do you have coverage for? Because that obviously affects the 70 and 80.
I think, as I've said before, we are going to be in a cycle of being vaccinated for COVID into the future. And so there'll be updated recommendations. At the moment, we're trying to get first and second doses into everyone that need it, and as I've indicated, there are still many people that have been eligible for the vaccine for a very long time that are still yet to be vaccinated. Then there will be booster recommendations. ATAGI, the Australian Technical Advisory Group on Immunisation, is looking at all of the data and will make those decisions. And the Commonwealth has bought very large quantities of vaccine. And so our task at the moment to be focused on is getting as many jabs into the arms of people in New South Wales as quickly as we can. And can I applaud the efforts of both our state clinics, our GPs and our pharmacists. We need to put every jab in arms. The Commonwealth has achieved some bring forwards through swap deals, and we need to make use of those increased supplies.
Sorry to press on this, but could it be that your vaccine passport to enter venues, for example, expires at 9 months or 12 months? Is that what we're looking at if you don't get the booster?
Yes, we have to work through those details, but at the moment, the majority of people have been vaccinated in a reasonably recent time. Obviously, there will be recommendations, and we will expect an ongoing level of vaccine coverage. But also, as we get that coverage high, and I think I've talked about my aspirational dreams of us being the most vaccinated country, we have generally been strong supporters of vaccine. We get about 95% coverage of our children in our vaccination coverage. So really, the future is in our hands. If we have those incredibly high levels of coverage in our population, and we have that engagement and easy access to booster doses, that will be a very better place for us to be in as we navigate COVID.
Do you think you can get to 9% in New South Wales?
I actually think that we can. Maybe I'm being too optimistic, but I actually think we can. And what I'd like the community to do is to be with us on that journey. I'd love to see us get to over 80% by early next week, and I think we can do it. And I'd really like to see those numbers pushed up as high as we can. We've got access to incredibly effective vaccines. Yes, will we need boosters? Of course we will. Will there be new variants that we'll have to be vaccinated with? Yes. But we have a great system for administering vaccines, for giving us our boosters, and we generally are a community that embraces the opportunities afforded by vaccines in preventing infectious diseases.
You expressed some concern about the over 70s. What sort of numbers are you seeing there of over 70s not vaccinated?
So look, it's been improving, and I've got to say I'm very greedy. ACT's probably got the highest coverage of over 70s. We've got fairly high, I think it's approximating a bit over 90% for first dose, but we're still not at 90% for double doses for the over 70s, which is what I'd like to be at. In terms of the over 50s, again, it's above the average. It's above 74% from my recollection, but again, that needs to be higher, and we need to get those second doses. So just to be clear, we need everyone vaccinated because we know that the data suggests that younger people, because they're more socially mobile, socially network, contribute more to spread, and that is why we've had a deliberate strategy of vaccinating in southwestern Sydney and western Sydney, particularly those younger groups that have not had access to the vaccine before. But again, we need to protect all members of our community, and we also need to make sure that we've got equitable distribution of the vaccine.
Apparently there's been a request for everybody that was involved in the search for the little boy to go and get a COVID test. Has that come from New South Wales Health? Are you aware of that?
Look, I'm not aware of that. I'm happy to follow that up.
Dr. Chad, we've talked about... Sorry.
So there's been a report of a case in a monastery in Putty. Have you don't?
Look, I've briefly, someone mentioned something, I just have to confirm it. Obviously, it's probably new overnight. But
that would be a huge concern given the scenes we saw yesterday.
Look, I think it's important to work through things factually. Let me get the facts first, and then we will issue the public health advice in a statement updating. But clearly, we will do everything we can to get that information out as soon as possible.
The Deputy Premier is saying that curfews don't work. Do you agree with him?
Look, can I just be clear? When we were seeing those escalating case numbers, health, as well as other government agencies, put up a range of options for government. It's really important to know that the evidence for curfews is mixed because you can't tease out one thing from a bundle of interventions. But we also did have local intelligence on the ground that there were some small segments of the community. And can I just say, the communities of southwestern Sydney and Western Sydney have been so, compliant and doing their best. But there were some reports that there were some groups that perhaps were associated with illicit activities and non-compliance that were really driving it. And the advice that police had was that curfews would also assist. Look, at the moment, I would love to see the case numbers stabilise and then go down. And I'm so proud of the communities of southwestern Sydney to see those vaccine numbers uptake. But can I just say we need time. Vaccines don't. As soon as you get a jab in your arm, you're not protected. We need to wait that 2 to 3 weeks, and we need to get additional vaccines and that second dose in. So the changes will take a little while, and that's why I'm always a bit cautious before jumping into any release of things in terms of the public health advice.
You talked about the arrangements for city hospitals and the surge capacity. What are we doing about regional hospitals? And specifically, can I ask you about Broken Hill, which used to transfer patients down to Adelaide, but I believe that's no longer possible. No. Can you give us an idea of what you've got in place for regions?
I'm not aware of any restrictions on removing patients to Adelaide. As you know, Broken Hill to Adelaide is a shorter distance, and we've had a long-standing relationships there. Obviously, patients are moved on a case-by-case basis, but we do work cooperatively across borders to ensure that people are provided the care they need. Obviously, our rural regional, we can support them in a couple of ways. One is we can make sure that they've got adequate staffing, and that can be supported by the city, where there's generally a greater preponderance of health workers. But we also have a network system. We have a great retrieval system. So we may preemptively move patients if a ICU in a regional area is becoming more impacted. Those decisions, as Ms Pearce indicated yesterday, they're operational decisions, and one of the strengths of our system is we are a network. Will it be stretched at one point in time? Yes, but everyone is in it together, and that's one of the characteristics of the system in which we operate in New South Wales, of which I'm immensely proud.
Dr. Chad, when the 70% double dose in mid-October, were you advised to delay opening up because there's that 2-week lag in the vaccine becoming effective, so that people don't expect that as soon as we get that 70% double dose, we're going to open up?
Look, we consider a range of factors. We consider the case trajectory. We consider vaccination coverage. We consider who's been vaccinated. Is that equitably distributed in the population? Have the vulnerable people in our population be vaccinated? So we consider a multiple of factors in giving our advice, and we keep on reviewing that advice in light of those metrics as they change.
New South Wales Health can confirm with us how many of the 1,550 surge beds were located in the regions. Can you tell us, have you been able to quadruple the capacity of ICU beds in the regions, or will you be relying on shifting patients to the city?
That's more of an expertise that I'd defer to my colleagues who run the operational aspects of health. But I think it would be a factor that obviously the capacity to surge is less in rural regional, and those operational decisions would be made as, again, in that very network system.
So you get the 70% vaccination coverage, right, 2 weeks before those most recent vaccines actually have an impact in the people who have them. So do you think we could open up when we reach that mark, 70%, or do we need to wait 2 weeks before the vaccine's set?
So we will be looking at all of those factors, including where our case numbers are. And as I said, the community's got, in terms of the public health advice and me having a level of comfort, the things that the community can do is bear with us. I know we've asked a lot of the community, but if we can just prevent any large spreading events by people not following the public health orders, if we can get industry to redouble their efforts to keep their workplaces safe, if individuals can stay at home, and if everyone can get vaccinated, that will give us a lot leeway. We'll also look at where we've got achieved first dose and second dose. But to some extent, where we appear in 3 weeks' time is actually in the hands of the community. And as I said, we've always got choices, and for me, the clear choice is follow the public health orders and get vaccinated.
Listen, just in terms of the rollout, obviously we've been funneling first doses into arms, and that's been the focus now. When we do reach 80% in about 6 days' time, are we then going to shift focus to bring forward those second doses? Because a lot of people who've had Pfizer, especially the Polish Pfizer, have been told that they've got 8 weeks to wait. You know, are we going to start shifting focus onto second doses?
So the injection of the use of the 530,000 doses to particularly lift up the vaccination coverage in that highly mobile 16 to 50-year-old age group in southwestern Sydney was a deliberate strategy. That was showed to give us the greatest impact on transmission by getting a dose into people. What we now need to do is, at the moment, when we made those decisions about the interval, that was because of the supply that the Commonwealth had procured in relation to vaccine, and we knew that in the end of October, that was when we would be able to get a vaccine into individuals. Because we had the choice, do we do 250,000, get vaccines, but then hold supply, versus get 530 on the path to vaccination. And the modelling clearly showed that was the better outcome for us. Now, obviously, as vaccine supply increases, then we will, we will encourage people to get vaccinated earlier, pending supply. And as I said, the options for people to get vaccinated will be increasing in terms of, as you know, the Moderna is going out through pharmacies. We've got our increased supply that will be going out to GPs, and we've got our own state-run clinics.
And Dr. Jan, what do you understand the impact of those 530,000 doses has been? I mean, I know you said this was a strategy you sort of borrowed from provinces in Canada. Has it played out in the way that you expected it would in terms of tackling the virus in the hotspots?
I think the story is yet to be written on that. It's too premature. What we would hope to see that impact flow through. Remember, the last doses of that vaccine was only given last week, and I'm going to need 2 weeks to really see the impact. But clearly the models, and we all have to use the best available information, shows that they will have had an effect. But I'm actually very greedy. I just want those communities to continue to go forth and get vaccinated. I want them to continue to go forth. I want those communities as protected as we can. They have borne the brunt of this, and for me, we need to even redouble our efforts and get those communities vaccinated and protected into the future.
Sorry, you mentioned... sorry.
Do you want to take the next question?
You take it.
Okay. Deputy Brady, can we ask you about the trials of, as we were saying, the roadmap trials? We're expecting them at the start of October, is that right? And what industries can people have? And what are the parameters that you're looking at? I understand it's one LGA in Sydney and one LGA regionally, and is it pubs and restaurants? What can people look for?
Can I make this absolutely clear that no decisions have been made in relation to the roadmap? We're still finalising the roadmap. The Premier tasked a number of us to achieve that. That roadmap will still be discussed at Crisis Committee. When we're ready, we'll release it, and that'll also include if there are going to be trials, where those trials and what those trials may look like. We know that the Minister for Customer Services, Victor Dominello, whenever he looks at new technology and the new technology that sits in behind the QR codes for vaccination, will need some level of trial. Could be internal, could be external. These decisions haven't been finalised or made, so it's a great question, but it's a question that we're not ready to answer. Sorry, just one more here.
The Premier said we needed a pilot for Victor Dominello's vaccination certificate, right? But we've only got a week before this vaccinated people can go to picnics. How are they going to prove their vaccination status? And if they need to prove it, why can't we just use whatever?
No. So firstly, when we're talking about the pilots and the vaccination passport, this is to do with the roadmap when we hit to 70 and 80%. At no point did we say there would be a vaccination passport for what are the freedoms that we have been given on September 13, which is picnics, etc. Police will be police.
That's not true.
You still have to prove your vaccination, but it's not the vaccination passport that we're doing the work through Service New South Wales. So you'll have the ability to download your app from Medicare, immunisation records, which we all have. Anyone that's been vaccinated will have that, and on your MyGov app. So that's the proof, or you've got to be able to prove that you got vaccinated. That's actually part of the conditions of having those freedoms that you've got to be able to prove if you are called up by police.
But why do you need to pilot something if in a week's time people are going to need to do it anyway?
It is a different. The premise, right? It is a different product. Firstly, secondly, we're still in the development stage. We're not ready to go to market in the public domain. So let's not confuse the issue here. We have a vaccination passport through the QR codes that we will deal with for the roadmap for next week when we get that level of freedom and people can start enjoying a get-together, a picnic. You'll still have to have a level of ID and proof of immunisation or vaccination, but they are two separate issues.
Are you really saying it was only media pressure that caused the curfew decision?
Well, you've just heard what Dr Chan has said. There's no question that police and health advise the government in relation to curfews.
Well, that's not what you said yesterday, is it?
Hang on. What I said was, firstly, I was asked about a question in relation to Dubbo, would I impose a curfew on Dubbo, and I said no, I would not. And the reason I would not is if you look at Victoria, they've had a curfew from day one, and what has it done to their rate? Their rate's accelerating, and we're seeing their numbers continue like that. But in Western Sydney and South Western Sydney, we're at a point of crisis. There was no question that we had escalating numbers, and therefore we looked at other tools and measures in relation to dampening or suppressing what was occurring. And therefore, on the advice of police and on the advice of health, the government made a decision about curfews. If you take everything I said in context, you would agree with that. Curfews play a role in compliance. Compliance was the issue that we were seeing that was problematic, and that's why the police and health put that forward.
Premier, the ICAC is examining legal briefings from your department about... The ICAC's examining legal briefings to you from your department about potential corrupt conduct allegations against Darryl Maguire. The ICAC's described those briefings as directly relevant to its investigations. Why didn't you declare a conflict of interest to your department? Did you breach the ICAC Act by not disclosing your knowledge of Maguire's dealings? And you've previously said you're not under investigation by the ICAC or an adversely affected person by its investigation. Does that remain the case?
I have nothing further to add on that matter, as I've said previously, and let the agency do its work.
Are you under investigation by the ICAC, Premier?
As I said, as I always say, that is a matter for the agency to do their important work, and it would be inappropriate for anybody to comment publicly on that work.
You've previously commented that you're not under investigation by the ICAC. Why do you no longer say that?
I have said this is a consistent response. It is not appropriate for anyone to comment on activity which the Integrity Agency is undertaking. Let them do their work. I have nothing to add. No.
So you're not a person?
No.
You were previously willing to say that you weren't under investigation by the ICAC.
As I said, these are matters for the Integrity Agency. I've never commented on matters relating to their investigation. That's for them to undertake. Ashley.
Premier, you've spoken a lot about the national plan and about moving forward together. Now, it's become aware that New South Wales are getting a lot more vaccines because of the situation we're in. Where does that leave the national plan? If when we hit 70 and 80%, are we just going to push on by ourselves?
Look, as we've said, when we get to 70% in New South Wales, there's no doubt people will experience many more freedoms, much more freedoms than what we're experiencing today. However, I don't anticipate internal borders to come down until the nation reaches those targets. So it's likely that New South Wales will reach those 70% and 80% double dose vaccinations ahead of other states, and that's understandable because we have a current outbreak and we've really been pushing our vaccination. So I don't anticipate internal borders to change at that stage. The national plan says that the nation has to reach those targets, but what it does mean that internally we all live much more freely than what we otherwise would.
Apparently, Premier, this is a slightly odd one, but apparently Guy Sebastian's come out this morning criticising the vaccination campaign and saying people shouldn't be told what to do when it comes to vaccinations. He obviously has an enormous number of fans. Does this message concern you?
Oh, look, it's a democracy and people have views. You've heard Dr. Chen and myself talk about the importance of getting vaccinated, and we need to rely on the health experts at this time. And we don't want to see anybody end up in intensive care, anyone lose loved ones because people aren't getting vaccinated.
Rapid antigen testing occurring at New South Wales Parliament today is a sign that Parliament will return.
Oh, look, I'm looking forward to Parliament returning in October when New South Wales starts opening up, and I'm looking forward to life getting back to normal. And hopefully all of us will experience things very much differently than what we do in September.
Given that Parliament is implementing RAT testing, will you start implementing it across all government work sites, like bus drivers have been asking for? What's delaying that? I know there's trials, but can't you just expedite the process?
Look, there's obviously an approvals process which has just been gotten through at this stage, and obviously workplaces will have those opportunities in various settings. But the most important thing, the most important protection is vaccination. Rapid antigen testing does have an important role, but it's obviously not as accurate as the PCR testing. So our biggest, strongest message is get vaccinated. But whether it's business or whether it's government sites, there'll be opportunities for those considerations to be made.
Premier, Parliament House, it's a workplace where people come from all over the city, hang around in two big rooms, then go out and mingle with the public, go to schools. Would you consider making vaccination mandatory for parliamentarians and people like us who hang around?
Well, I certainly hope that all of you are vaccinated. I wouldn't want to be in the room with lots of people who aren't vaccinated, and I certainly hope that all of our colleagues are vaccinated. That's the message we've been sending the community, and obviously as workplaces open up, every workplace will have their policies according to what the government's indicating. But I just want to make this point very clear. If people want to enjoy the things that we've missed, such as a meal or any other issue or any other venue, they're going to have to be vaccinated. And just to clarify a point made earlier, just for complete clarification, the system New South Wales is developing means that when you check into a cafe or a restaurant with your QR code, that will automatically blip that you have already been vaccinated as well. That will show both your vaccination status and your check-in capacity in the one app. Now that's what will be piloted in early October. But what already exists is any one of us who've been vaccinated can go through the Medicare website and download a proof of vaccination that we've been vaccinated. And that's what people will be asked to do when they're going out for a picnic or when they're gathering outdoors, as we've indicated from next Monday. So I just wanted to make that distinction. The Medicare application is available now, but for convenience sake, New South Wales is developing our own product where if you check in anywhere at those venues which only allow vaccinated people, you'll also have your vaccination status pop up.
Be convenient to have it pop up on your Service New South Wales app. But if you can already do it with Medicare, why do you need to spend, however long it's going to take to test Victor Dominello's Service New South Wales thing?
Well, I was hoping you'd cotton on to the fact that what it saves people doing is if you go to a cafe. No, but if you go to a cafe, this is an important point if you're not understanding. If you go to a cafe and you check in, right, you don't want to then have to pull out a separate document showing you're vaccinated. You want it all to be seamless. And the venue also wants it seamless. So technically, a lot of venues won't let you check in because you won't be vaccinated. So this product means that when you put your QR code on a cafe or a restaurant, it will say you're vaccinated and you'll be allowed into the venue.
Though than just using what already exists to actually get it up and running. Only worried about that.
I'm sorry, I can't hear that question.
Only worried that that's going to take longer to implement, so that it will delay us going back to the cafe.
No, well, that's why we're having pilots in place, and that's why we anticipate the product will be ready by the time we allow people into those venues. That's the whole point. The whole point is having a one-stop shop on your phone so that when you check in, it also confirms you've been vaccinated, and it's much easier for businesses and for us. So you don't have to go through a process 2 or 3 times at the one venue. You don't have to pull out a separate piece of paper to say you're vaccinated. You don't have to pull out a separate app to say you've checked in. It's all done in the one spot at the one time, and that's better for businesses, and it's certainly better for individuals as well.
Dr. Chair, drive-through clinics in Western Sydney that we're looking at setting up.
I'm sorry?
Any more details on the drive-through vaccination centres that we're planning to set up?
Well, obviously the Commonwealth announced that, so we have our own mass vaccination centres in terms of the physical locations we already have. We've also been doing pop-ups in various places in Western and South-Western Sydney. So, for example, at places of worship or community halls, we've been going there with our vaccines to say this will be available for the next 3 days, please come forward and get vaccinated. So the New South Wales Government, through New South Wales Health, has a number of what we call existing mass vaccination hubs, as well as lots of pop-up clinics we've been doing throughout those areas of concern in particular.
Sorry, I just wondered, can you tell us what some of those are? Is it diabetes, heart disease? Is it something like asthma even, that are underlying health conditions when you mention these tests?
So I think it's clear, and there's a range of underlying health conditions. So people might have cancers that make them immunosuppressed. They might be on immunosuppressive treatment. They might have existing lung disease. If they've got chronic obstructive lung disease, emphysema, those sort of diseases. Diabetes puts you at increased risk. Obesity puts you at significant obesity puts you at risk.
So is that an underlying health condition? When you say someone's died and they're obese, is that an underlying?
No, we're not counting obesity.
Because that's my question, sorry.
Yeah.
Could asthma be included, for example?
I am not saying that none of our cases have had asthma, but when I've been reading through the details of the underlying health conditions, just of the ones that have died most recently, there've been significant underlying health conditions, often multiple comorbidities. But I think rather than dwelling on that, because I just want to convey that vaccines work even with people with underlying comorbidities. And it is important that people are vaccinated. And when you think of the fact that our experience with aged care facilities has been very different than we would have experienced in the beginning of the first wave, and that's because we have vaccines. So I don't want anyone to get the impression that if you've got an underlying health condition that vaccines won't work. They will. But obviously no vaccine is 100% effective, and if you get a disease, even if it's milder, and you're very unwell, then obviously it will. You might be more likely to die. So I don't want to convey any sense that vaccines do not work. I really want anyone with underlying health conditions to be particularly protected at this point in time, to get their 2 doses as quick as possible.
Talking about the return of Parliament in October, and once we hit that 70% double dose rate, can the business sector also be looking at that and thinking that they are going to be able to get staff back into offices in the CBD? What is your plan for bringing people back into the CBD, which is really very much a ghost town at the moment?
Well, that's why obviously we're working on the roadmap to see what is a safe way to start opening up at 70% double dose. So those are the considerations that we'll rely on from the health experts to give us. And obviously 70% double dose vaccination is an important milestone, but obviously 80% double dose brings us even more freedom. So there still could be the case that we recommend people work from home unless they have to at 70% double dose. That could be the health advice. But it still means that you'll be able to do all those things that you can't do now. But I don't want to give anything definitive at this stage because we're still awaiting. I mean, every day we have these conversations with the health experts and the roadmap. And obviously the closer we get to implementing that and publicly releasing that, we'll be able to give some more definite answers. But it could still be the case that if you can work from home, you should at 70% double dose, or it could be the case that it's safe to go into the office, and we'll be able to give those details. But my very strong message to the hospitality sector is dust off your COVID safety plans. Things will be reopening in October, and we thank everybody for their patience and what a frustrating time it's been. And let's hope that October reopening also means it's the last time we ever have a statewide lockdown, because it means in the future we'll be able to deal with any outbreaks on a very localised basis, given how much the vaccination rate is, how high the vaccination rate is throughout the state. And that's the whole purpose of getting high rates of vaccination. It protects us against having to shut down the state, which none of us ever want to see again.
ICU nurses are signing a letter and they want to meet with you about, they say that there's a crisis there and about staffing issues. Will you meet with them, given the modelling that was released yesterday?
Well, obviously, the modelling released yesterday also confirms the various plans put in by staff. I've been in contact with a number of staff and a number of health experts who've given government direct advice, and obviously the Minister for Health is always in daily contact with staff as well. And no doubt when you have 140,000 staff throughout the health system, people are going to be worried, but the vast majority of people I speak to accept the stressful time ahead, but also are up for the challenge. They've worked all their careers to support the community during the most difficult time, and none of us said it's going to be easy, and we put our hats off to all those people who are willing to put their own safety on the line to protect others, people like Auntie Pauline, who works with COVID patients and others, and certainly no one is suggesting it's going to be easy, but what we wanted to do as a government, what we wanted to do in terms of the health advice is provide exactly what we had, so that everybody is aware of the information that's been presented to me in the government, so that we all know the plans that have been put in place, and that's why we're also keen for specialists to brief everybody and speak directly on the plans that they've put themselves in the language that they've used to make everybody aware of what we're likely to expect.
If you said localised, to clarify that, did you mean that we might see LGAs go into lockdown post 80%?
Well, until you get to 80% double dose, the Doherty report says that from time to time there may be some restrictions that come in place temporarily. So it's not till 80% double dose that prevents you from ever having a statewide lockdown. And so it's critical we don't anticipate, because of the rates of doses in New South Wales or the vaccination rates, we don't anticipate there'll be a big difference in the time between 70% double dose and 80% double dose. Once we hit, Dr. Chan and I are closely monitoring the day that the state hits 80% first dose, because then we'll have the confidence that we're going to get to that 80% target, which a lot of places around the world haven't even achieved yet. But at 80% double dose, the Doherty report says that there's no reason why you should have a statewide lockdown, so long as you maintain an eye on those outbreaks from time to time. But as we know, there could be issues where a workplace has cases and may be temporarily closed. There could be a school. We've seen that already during last year when we kept the state open. There were instances when, if there was an outbreak, there'd be a temporary closure or dealing with an issue, and that will be part of living with COVID. If there's a high concentration of cases in a small area, whether it's an institution or an establishment or a venue, well, obviously for a small period of time that venue or that activity won't continue, but that will be very localised and temporary, certainly nothing like what we've experienced this year or even last year.
Premier, do you agree with Premier?
A very dire picture of the next couple of weeks, talking about ICUs hitting capacity and surge capacity plans and having to train physiotherapists and all the rest of it. Today we're talking about roadmaps out, 70-80% and opening up. Two very different stories coming together at the very same time. People are looking at this and going, are you absolutely sure this plan to open up is the right thing to do in the middle of what you've described as an overwhelming situation in the next couple of weeks?
Oh, there's no doubt there's challenges ahead, but this is the strategy that we know will see New South Wales through this difficult period. This is part of the challenge of living with COVID and part of the challenge that every state has to go through. Interestingly, vaccine supply was made available to us during the worst outbreak that New South Wales has seen and Australia has seen. And coincidentally, the worst time in hospitalisation is likely to be the time that we open up. But that shouldn't stop us from proceeding with what is a safe thing to do. We know that living with COVID is challenging for everybody around the world, but we have a very planned and safe approach. And we are confident that the people of New South Wales will welcome those freedoms they'll experience once we get to those high rates of vaccination.
It's John Barlow, right, that the curfews in southwest and western Sydney haven't worked and were only introduced because of media pressure, and are you considering lifting them at all?
As Dr. Chant said, the advice government received came from health and police, and we can't touch any of those restrictions unless health gives us that advice. Well, there's a question mark over any of the restrictions. In combination, they've clearly worked, because otherwise we'd have thousands and thousands of cases and hundreds of deaths. So clearly the combination of restrictions has worked, but what weighting every single restriction has is as good a guess as anybody's. But the real answer is the combination of restrictions have definitely made sure that we haven't seen the thousands and thousands of daily cases that similar populations around the world have seen. I mean, in some places, populations the size of New South Wales, they're in the tens of thousands of cases every week. We're certainly not at that stage. And there's no doubt that the restrictions and the lockdowns have had a positive impact, but how you rate the weighting of every single one, I doubt anybody would be able to pinpoint.
Thank you.
Thanks, everybody.